Hello, I'm Dr. Mike Shimmel. I've been practicing chiropractic since 1987, and we've given thousands and thousands of adjustments to properly keep the vertebrae in the spine functioning, and when they don't function properly, it's called a subluxation. So that's the main thing we've done in our office. But lots of patients want to know what they can do at home, and so we've taught our patients many of stretching exercises to keep the muscles in balance. But one big question I get a lot of is, Doc, what about an inversion table? I get that quite a bit, and an inversion table would be great if your body was only a spine, because hanging upside down does separate the vertebrae and increase movement in the joints. But unfortunately, your body is made up of a heart, lungs, and a lot of other body parts that aren't really meant to be hanging upside down. So you get all this blood in your head, you put more pressure in your sinuses, you could get retinal detachment, if you have any type of reflux in your stomach, it's just, the list goes on and on and on. So what we have come up with is a unit where you hook a band around the lower back and it stretches and opens up these joints. So basically what we get is this space here is called a disc. Now as the years go by and the stress of gravity and all the things we do in life, it starts to thin and thin and thin. What happens then, you can see this little yellow thing here is the nerve that exits, and you'll get quite a bit of pressure in there. So the unit we designed actually stretches apart these joints and you're not hanging upside down. So in a few minutes I'm going to take you back to the unit and show you what we can do. Now just laying in the unit and stretching and pulling that spine is very therapeutic. But we've also come up with a series of exercises now that you can do with the unit to keep the muscles more in balance in the pelvic and low back region. So what I would recommend you do is go ahead and get one of the units, try it for 60 days. If you don't like it, just pay the shipping and we'll fully refund your money. But I have a strong suspicion that you'll end up keeping the unit because you'll like, we've been using it now for about 4 years in our office, and many patients have benefited from the great effects that has produced for them. So, alright, we'll see you in the back room in a few minutes. Okay, I want to show you the tractioning effect that the dynamic back stretcher can do here. So Bruce is in the unit, and what we're going to do right there, he's getting a little bit of traction effect. So we want you to start in this position for the first couple of times. Okay? As you get used to the unit, you can continue to pull yourself away from the unit and to get more of a traction. So you can see here, he's got a little more pull or a little more angle on the band. Now note, he also has his knees wider than the band, so the band does not slip off of his lower back. Okay? So this is a perfect position. Okay? And as days go by and weeks go by and you need more traction effect, you can go ahead and pull yourself back, Bruce, keep going one more time. And the arm's resting there. That's as far as anyone should ever go on the unit. Okay? Now, if you do this right away, you will put yourself into a back spasm or potentially put yourself into a spasm. So you want to work up to this position, okay? Bruce has been using this unit for a while, and ultimately he doesn't want to stay in this position for very long, okay? So you can see there's a nice tractioning effect. He's not hanging upside down. There's no blood rushing to his head, and it's very therapeutic for the lower back.
As you can see, getting into the unit is very easy. And once you also finish with the unit, getting back out of the unit is very easy as well. Just slide it up and use your body weight and mechanics to stand up. And then when you're finished with the unit, just pull up on the bars in the middle a little bit and you'll be able to easily fold the unit and store it wherever you can in your home. or under your bed.